All right, well, we are going to go ahead and get started. Welcome, everyone, to the January 2026 monthly meetup of the Iowa Hunger Coalition. My name is Luke Elzinga. I'm the Policy and Advocacy Manager at the DMARC Food Pantry Network in Des Moines, and I also serve as the board chair of the Iowa Hunger Coalition. If you're new to these calls and new to the coalition, just a little bit about us. We are a membership-based 501c4 organization. We have a volunteer board of directors, no paid staff, but we do contract lobby through Peterson Consulting, John and Cindy Peterson and their daughter Libby. They do a great job for us. And we really try to bring together individuals and organizations to address food insecurity and build equitable food systems in our state. This is IHC's mission and guiding principles. So our mission is working to end hunger in Iowa through education, advocacy, and policy change rooted in justice. Our three guiding principles are hunger is a policy choice, nutritious food is a human right, and ending hunger requires solidarity, not just charity. If you want to learn more about those three guiding principles, you can visit our website, iowahungercoalition.org. Right there on the homepage, there's a little more information about each three of these guiding principles. These were written by our membership last year and really are what we try to stay rooted in. So first, just wanted to check if everyone had heard. Summer EBT is happening in Iowa in 2026. And I just want to take this moment to thank every single one of you on this call for all your hard work in making this happen. We have been keeping at it for the past 2 years to make sure that Iowa participates in summer EBT. And it is because of all the hard work that you've all done advocating for summer EBT over these years that we've gotten it across the finish line. So I just want to take this moment. I know there's a lot of you on this call who personally worked on this really hard, gathering petition signatures, meeting with legislators, sharing about this with your neighbors. And so just really wanted to lift up all of our collective work and thank you all for your hard advocacy. And we're really excited to see summer EBT happen this summer. And we're going to be working hard over the next few months to make sure that this program can be a resounding success for the state of Iowa. So thank you. Pat yourselves on the back. Our work's obviously not over yet, but did want to just take a moment. We haven't had a ton of wins the past few years, and this is a big one. And so you should all be really proud of yourselves and all the work that you did. And again, this is why we exist, to work together to advance policies to address hunger and food insecurity in the state. So thank you. Well, we're starting off on a high note, and unfortunately, it's probably only going to go downhill from here. But some state policy updates. First, I just wanted to share, we've gotten some recent numbers from the state that they've put out related to SNAP enrollment. And we've been seeing quite a significant decline in the past few months. So since August, SNAP enrollment in Iowa has fallen by 5%. And right now, we're about at an 18-year low. SNAP enrollment is the lowest it's been since May 2008. And there's a couple reasons for this. One of them is the changes from HR 1, the One Big Beautiful Bill Act, that is starting to go into effect, where refugees and asylees are no longer eligible. There's additional work requirements. That is definitely starting to have an impact. The huge drop we saw in November is likely due to the government shutdown. We know that HHS saw a lot fewer applications for SNAP when the government was shut down and those benefits, were being delayed. And so we think that's probably has the most to do with that more significant drop in November. But you can see we've been seeing a gradual decline, and we're going to continue to see that, I think. Just a reminder, the Iowa Hunger Coalition on our website has this SNAP map tool. We take that F1 report that I had a screenshot of on the last slide from the state and try to make it a little more interactive. So you can visit this. You can see what the stats are like for December, but you can also see historical trends, county level, congressional district level data. So again, please remember this tool and resource as you're talking about SNAP and advocating. This can be really impactful when you're talking with legislators to share, really up-to-date information from their home county or district. We also had some news come out at the end of the year. USDA released its household food security report for 2024. You may have seen a little bit of news around this. Iowa's food insecurity rate rose from 9.8% to 10.8%. So again, we continue to see food insecurity rising. And if you'll also recall, USDA has announced that they are ending the annual household food security report and the underlying survey that gathers that data. And I want to be clear here, this is really kind of the gold standard for hunger and food insecurity data. There's some other reports out there, but a lot of them use this data as their base. So for example, Feeding America's Map the Meal Gap study uses the CPS FSS as the underlying data set. So not only are we losing this really critical USDA report, we're also going to be losing a lot of other reports that use that data set. Another update from HR 1. If you've been following along, one of the big changes in that bill was changes to work requirements. And I don't have them all laid out here on the slide, but do have kind of a front and back handout in somewhat as plain language as we could get. What are some of those changes to the SNAP work requirements? The biggest populations this will affect are older adults ages 55 to 64, parents and caretakers of children 14 and up. There were also some exemptions removed. So you can access this. It's just an unbranded front and back at this QR code or this short link. And please reach out to us, iowahungercoalition@gmail.com, if you have any questions about that. This really started in November because of how SNAP work requirement works and the 3-month time limit. We'll probably really be seeing the biggest impact from this starting in March as folks start to lose benefits if they can't meet that work requirement. And then we had Iowa's SNAP waiver requests go into effect on January 1st, 2026, obviously this year. Those restrictions are tied to the state's sales tax on food and beverages. I know we've covered this a lot in previous meetups, and so I didn't have all the complexities outlined here. We can certainly do a review of that if people need a refresher, but at this point, I'm going to stop sharing my screen and just really wanted to open this up for discussion of what folks are hearing on the ground related to this SNAP waiver that went into effect. Feel free to raise your hand, come off mute, post in the chat. Yeah, Jan, go ahead.
Thank you. Our little group, this North Iowa Food and Community Care Group, is sort of a partnership between some folks in Wright County and Hancock County, and Mary Byerhelm Huey up in Cerro Gordo sits in on our calls sometimes. And we've just asked ourselves, so who is helping provide any interpretation, education. I think our question was kind of thinking about the retail entities themselves. And we said, well, let's ask around. So asked our public health, and no, they don't do anything about it. Then they directed me to the North Iowa Community Action Organization, and I talked with them, and they said, well, we're doing some outreach to the clients themselves. But they were told somewhere on the line that they cannot do any outreach to retail outlets. And the reasoning that was explained to me was, if I can get this correct, it's like, I think this is a rule that affects only some of their shoppers, not all of their shoppers. And so they're not supposed to be, I don't know, bending over backwards for a small group of shoppers. I'm sure I don't have that completely right, but um, it it seems like all they could direct me to is what's been put out by IHHS, which is, I guess, kind of on the vague side. And so the end of our conversation was simply acknowledging that this leaves SNAP users to sort of stumble their way through it. And in that case, it just heightens any kind of being called out. And she said, folks who maybe already feel a little less than are often just going to have that sort of elevated. She did acknowledge that Hy-Vee in Mason City, because this group is based in Mason, has observed some signage on the shelves in Hy-Vee. But most of our shops around here are not of a major chain like that. And I haven't been to our little local Fairway here to see if they've done anything, but I just thought it was really kind of odd reasoning why they couldn't help. Now, I don't know what capacity they have anyway. So before we go doing all sorts of things, we were interested to see what's coming out of this conversation and if there are some handouts such as you just talked about with the work requirement. So thank you.
Yeah, Jan, thank you for sharing. I had not heard that related to the retailers, and I'm probably going to do a little digging to try to understand that better. But other folks, does anyone want to share maybe what you are seeing in your area of the state, whether that's on the retailer side or hearing, from folks coming to the food pantry, how they are navigating that? And Jan, I will just also note, the Iowa Developmental Disabilities Council has put together kind of a plain language one pager about the SNAP restrictions, and I think they're waiting for kind of sign off from HHS. But we can certainly circulate that and any other kind of plain language notifications. It's really hard because people are basically told consult the tax code, and so that there's not like a simple way of saying here's what it is, here's what's not, without really digging into item by item some of those questionable pieces. So
That's the Iowa Developmental Disability. Would you say it again?
yeah, it's
Group
the Iowa Developmental Disabilities Council,
Council. Okay. Thank
and
you.
I can send that along once they have it finalized and approved. We'll also be sharing a bit more about, steps IHC and we all can take together related to this. And yeah, I did see Hy-Vee's, it does seem like are starting to label some SNAP eligible, non-eligible. So I think it really depends on the retailer. Anyone else?
Luke, this is Claudia. By that, do you mean that the manager has some options as far as signage, or is that a corporate decision with Hy-Vee?
Probably a little bit of both. I think store managers probably can kind of have more determination of like what signage and things around the store they want. But as it relates to the point of sale system, my guess is that has more to do with Hy-Vee corporate. And so like, I've seen those little, they're called like the shelf talkers or the price tags that have like, like an interactive digital display. On some of those, they've actually been having like a little snap, like little icon in the corner if something is SNAP eligible. So that I think is probably on the corporate level and not a store to store decision. But like in-store signage probably varies more. And yeah, Ron, I was at a Walmart last night too, and I did not see any sort of shelf talkers about what is SNAP eligible or ineligible either. And that may change in the coming weeks. We'll have to see.
Great, thanks.
Anyone else? Well, feel free to keep adding things to the chat. We are going to go through a little bit more details of the restriction waiver. Share my screen again. All right. So I know last month and previous months, we've really dug into what those restrictions cover. I just wanted to spend a little bit more time, and sorry, this is the boring, like fine print stuff, of just some of the finer details of Iowa's SNAP waiver. So we were granted the waiver in May of 2025. Obviously, it just went into effect January 1st. Our waiver with USDA Food and Nutrition Service is for a period of 2 years. So it's from January 1st, 2026 to December 31st, 2027. The state does have the option to request 3 annual extensions, so up to a total of 5 years. It says for a period not to exceed 5 years. And any request for that initial extension must be submitted by June 30, 2027. So it is a 2-year waiver with the option to extend for multiple years up to a total of 5 years. Prior to implementing the SNAP restrictions, the state was required to meet a number of terms and conditions of the waiver. And this is outlined in Iowa's kind of waiver approval document. And that's on the USDA's website for anyone to access. And I'm sure, sorry, I should have linked it here. So HHS had to submit all of these things to USDA before our waiver went into place, including a finalized proposed budget, a communications plan and compliance and monitoring plan for retailers, a communications plan for households, a finalized evaluation plan that kind of walks through, the health outcomes and behaviors they're going to be looking at, how the state defines success of this waiver, and a detailed description of all the data points and metrics the state's going to be looking at. And then also any completed contracts between the state and any other entities the state's working with to evaluate the waiver. So we assume all of these things were submitted and accepted because the waiver did go into effect on January 1st. We haven't seen all of these. We've seen a few thanks to awesome SNAP advocate Mark Craig. I'm not sure if he's on the call, but props to Mark. We've seen a few of them. And this is from the retailer communications plan. And I really want to key in on this piece. There was a list of obsolete tasks that HHS listed, and one of them is a specific eligible food list. Coming up with a list of accepted items so retailers can work with their point of sales vendors and others on implementation plan. The state did not do this because they deemed it too tedious for our internal HHS staff to complete, so they just referred retailers to the Department of Revenue Tax on Food page. That's also where they are referring SNAP participants. So again, Iowa HHS said coming up with this list of what's eligible, what's not is too tedious. So we're just going to make the retailers and SNAP participants do that. We also saw some updated retailer guidance from USDA FNS come out at the end of the year related to these SNAP restrictions. So USDA announced that there is a two-strike policy for retailers related to these SNAP restrictions if they're selling items that should be banned. Now, they do have a 90-day grace period. So we've got 3 months for retailers to get in compliance. But after that 90-day grace period, if a retailer is found to be violating this policy, on the first instance, they receive a warning letter. And on the second instance, the retailer will be involuntarily withdrawn as a SNAP authorized retailer, meaning they will no longer be able to accept SNAP benefits. If you want to dig more into all the wording of this memo, I have a link on the bottom of this screen here. We'll send the slides afterward. You can dig into that. There's also some guidelines around how it works for retailers, that might operate in one state but are selling to another state, online retailers, and that sort of thing. So if you want to dig more into those specifics, you can do so there. So what comes next? We've got this waiver in place for 2 years. Iowa has to submit a quarterly report to USDA FNS. And one of the things in that quarterly report is the number of compliments and complaints that they have received from SNAP users, retailers, and other advocacy groups. So for retailers, there is an email address that the state has created to provide feedback. We don't really know what the channel is for providing feedback from SNAP users or other advocates. It's not clear. They don't have a dedicated email or phone line for this. So we're trying to learn a little bit more. But I think right now what we can be doing is gathering stories from folks. If you are hearing people and their experience of navigating this, any confusion that's caused, both on the retailer and SNAP user side, it's going to be really important to gather feedback. And I have complaints here, but compliments as well. If there's anything that is working well, that's something that the state is going to be reporting to USDA on a quarterly basis. And so making sure we're providing feedback. Also, we can be working to ensure that Iowa does not extend its waiver beyond 2027. Again, next June is when the state will be making that decision. And so what can we be doing? Also knowing that we're going to have a new governor. And regardless of which party they're part of, we can be educating candidates now about this impact and the negative effects it's having on SNAP participants and our local economies. And then also resisting efforts to make these restrictions permanent at the state and federal level. I think we can, generate stories of how this is impacting folks and really try to bring those to our federal policymakers as well. All right, questions on the SNAP restriction waiver? I'm going to check the chat real quick. I do see a comment from Ron. The tediousness is one of the reasons that Clay County people are giving up on SNAP altogether. I think you're absolutely right. When we make it harder for folks to access the program, when we increase program stigma by having restrictions like this, that leads to less people utilizing benefits. And again, we have food banks and food pantries breaking records across the state, and SNAP enrollment is already near an 18-year low. All right, well, we are going to jump into some legislative updates on the state level then. Last month, we unveiled our full state legislative priority agenda. These are the top level items, but we kind of have sub bullet points for each of these. If you visit iowahungercoalition.org, go under the advocate tab and down to policy priorities, you'll be able to see some of those more specific policy recommendations. But really, these are our main 4 buckets: strengthening SNAP, building on the success of Choose Iowa, streamlining school meal access, and ensuring Iowa's annual participation in summer EBT, which we've already got for 2026. Now we'll need to work to make sure we've got administrative funding for HHS, and make sure that this is something that the state continues to do in the future. But we've already seen some success there. All right, double up food bucks. This is a piece under our SNAP policy plank. For those of you who are not familiar, double up food bucks is a nutrition incentive program. It's been around in Iowa since 2016, when folks use their SNAP benefits to purchase fresh fruits and vegetables at a double up food bucks retailer. They can get additional benefits that can only be used to purchase fresh fruits and vegetables. So this is at a lot of farmers markets. It's also at some, at a lot of fairways and some Hy-Vees across the state, and some smaller independent grocers as well. We've never seen state dollars invested in the program. During the pandemic, there were some CARES Act funds redirected to double up food bucks, but we've never seen the state of Iowa have a state appropriation for this. And if the state invested some of our dollars, we could actually get a larger federal match as well. So that doubles up the double up. Senate File 2027 was introduced on January 12 by Senator Dan Dawson. So right at the start of session, and it is a clean $1 million double up food bucks appropriation. So happy news. The Hunger Coalition is already registered in support. This has been assigned a subcommittee of Senator Costello, Senator Donahue, and Senator Warmy. Also want to note, Iowa's state legislative session kind of goes in 2-year periods. So we are in, I think, the 91st General Assembly, and it was last year and this year. And so if there are bills that advanced a certain, made it far enough last session, they are still eligible at the start of this session. Senate File 232 was the double up food bucks bill that passed HHS committee in the Senate last year. It was just sat in appropriations. It's still sitting there. Both of these bills are in Senate appropriations right now. And because they're in the Senate Appropriations Committee, they are what is considered funnel proof. And some of you may be aware of this, others probably aren't, but the Iowa legislature has what's called the first funnel and second funnel. And it's a period, about a month or two into the session where bills have to advance past a certain committee to still stay alive. So there's a lot of bills introduced. The legislature doesn't have enough time to work on all of them. And so these funnels are really, ways of knowing what is still in play. Now, there's always an asterisk. We can always see some things brought back. But bills that are in appropriations are what's considered funnel proof. This means that maybe there's not going to be as much pressure to move them right away, because there's these other bills that need to get advanced to make it past the funnel. So both of these are in Senate appropriations, but we may not see movement on them right away. The committees are still waiting on their top level appropriation targets. So this is really positive news to see this early. But I just wanted to let you all know we might not see movement for a few weeks. We expect that. That's fine. But really encourage you right now to reach out to Senator Costello, Senator Donahue, and Senator Warmy. They are the 3 folks on that subcommittee. Their votes will be really key. And really, Senator Costello is the chair of Senate HHS Appropriations. And he is probably the most important person in the Senate who has a say in whether or not this gets across the finish line. So encourage you all to reach out, thank them for introducing this bill, and ask for their support in seeing this across the finish line this year. We've been working on double up food buck state appropriation for 6 or 7 years. Last year, it was in the HHS budget, was not in the Senate budget, and ultimately we didn't see it make it to the finish line. So we're feeling really good this year. Please encourage you to reach out with a note of thanks and your support. SNAP restrictions. I'm not sure how many of you watched the governor's condition of the state address or read about it afterwards. There was a piece related to SNAP that came up in the governor's address. And the governor asked the legislature to basically ensure that we have these restrictions going forward for SNAP and summer EBT. Now, we haven't seen the exact language of this. We also know that Iowa's SNAP restriction waiver says it's not supposed to exceed 5 years. So there's a question there. But we have seen in past sessions contingent language before. So you may remember from last session, there was a double up food bucks bill in the House that said, we're not going to appropriate this money unless the state puts SNAP restrictions in place. So we've seen this contingent language before. We'll need to be really careful and look at that language to make sure that we're not tying Iowa's participation in summer EBT, SNAP, double up food bucks to that waiver. Because again, we're only limited to 5 years. If we see changes at the federal level, that could put us in a really unfortunate position. So again, we haven't seen specific bill language yet, but it's something we're going to be on the lookout for, given the governor's bringing it up in her condition of the state address. Another big piece, and this is very in the weeds, I'm sorry, relates to SNAP administrative funding and IT investment. All of this ties back to HR 1, One Big Beautiful Bill Act that passed last summer. Right now, the state pays half of the administrative costs for SNAP, and the federal government covers 100% of the benefits. Both of those are changing. So effective October 1st, the state is going to be required to cover 75% of the administrative costs for SNAP. So that additional 25%, we are going to need to make up in this budget that we're working on right now this session. What that budget gap looks like, we've got a few different numbers. Leading up to this, we had been saying an estimate between $13 and $15 million. The Legislative Services Agency, LSA, it's a nonpartisan agency that comes up with fiscal notes and policy analysis. We've seen kind of 3 different numbers shared in different documents. So I guess what we can say right now is somewhere between $9 and $14-ish million of what that budget gap looks like. The good news is this is included in the governor's budget, which is really good news. We can point to that. We can support the governor's budget. We don't have to fight to get that added in. And so that's really positive news that difference is made up for. And we will be working to support that budget. Also, there is almost $20 million that's being requested for technology upgrades through the Technology Reinvestment Fund. This would modernize the state's SNAP IT system, which is older than I am. We are working right now with Deloitte to modernize that system. The state has a very aggressive timeline of getting a new system launched by January of 2027. But we also know with the benefit cost share that's tied to the payment error rate, it's really critical that HHS has the resources it needs to make sure that we can continue processing SNAP applications accurately and in a timely fashion. And we absolutely need technology upgrades. So we want to be supportive of that ask as well. And then we also saw right before the session an announcement from Secretary Mike Nag, who's the Iowa Secretary of Agriculture, unveiling the Iowa Farm Act. This includes making the Choose Iowa school purchasing pilot permanent, which is something that is on our list of policy priorities. House Study Bill 588 has been introduced in the House. We believe this is the Iowa Farm Act. It has a lot of what Secretary Nag talked about. Was just introduced, I think, yesterday, and has a subcommittee assigned, of Representative Derek Wolf, Representative Chad Bain, and Representative JD Scholten. So I think we are currently registered as undecided. There's a lot in this bill. We're definitely supportive of the Choose Iowa piece. So stay tuned for more on that. But some good news there as well. And so all of this, I'm feeling cautiously optimistic. I feel like I say that every session, but we do have some good things in the works and some really strong bipartisan policies. Want to extend an invitation to all of you to come to Des Moines on Thursday, March 12th for the Voices from the Front Lines of Food Insecurity Day of Action. This is something that IHC is hosting along with a lot of our members and partners. We'll be having an early start with a legislative breakfast, and then we'll be spending the morning talking with legislators about our policy priorities. You can register for this now. If you go to iowahungercoalition.org/advocate/day-of-action, or you just go to our website under the Advocate tab, click on Day of Action. You can register. We'll have an advocacy training the week before on the evening of Thursday, March 5, of just what to expect, things you can be doing in preparation for your visit, some basic talking points and latest updates on where things stand. We want to have a lot of people show up and make some really good contacts with state legislators that day to help advance our priorities. And yeah, you can sign up for that and register now. And please share with other food pantries in your area, staff, volunteers, people with lived experience. We're exploring ways that we can provide assistance for folks to get there if cost is going to be a barrier. So stay tuned, save the date, register now. We'd love to see you there. All right, I think this is my last slide, so I am going to stop sharing and open the floor for any questions, comments, other things that folks want to raise to the group. I'm going to give us like 15 seconds of awkward silence if anyone wants to jump in.
Luke, I'm so sorry, you might have addressed this already. Is the summer EBT funding also included in the governor's budget? Is that correct?
Yeah, I believe so. Yes.
Okay. I just wanted to make sure that I thought it was, but I wasn't 100%. Someone else was asking me recently.
Any other questions or things just people want to flag that they're hearing from folks?
I'm wishing I knew somebody at a grocery store to see how they feel like this is working out for them so far. And I might call our local manager. The Hy-Vee here, at least the one store that I've been in, has marked things, and I think that they've tried to do a really good job. But I'm concerned, as I think most of you are, that people are going to get up to the counter with items and there will be confusion and embarrassment about what is allowed and what is not allowed. I'm also wishing that I knew somebody at a Quick Trip or someplace like that that could, I'm afraid that rural retailers are really going to be discouraged by this. And I'm disturbed that you're going to be given two chances and then you could be cut off when I feel like that it's going to be challenging enough for them without the threat of punitive action being held over their heads.
Yeah, I would encourage anyone who has a relationship with a retailer to maybe just reach out and check in. I am also probably annoying to cashiers because I've just started asking that when I'm at the gas station or like, hey, how's this going? And sometimes you'll get some very candid responses from those cashiers. So yeah, I mean, I would encourage folks if they're checking out at the grocery store or at a convenience store, it's always worth asking. And yeah, if you have more of those like store manager connections too, just reach out and ask folks how it's going, how the implementation is going.
Luke, this is Claudia. So was it last month? I can't remember. We saw information about those border states and the impact, the financial impact of losing, in my case, to Illinois here in Davenport. So any information on that coming forward or how that's going to be tracked?
So in the quarterly reports that HHS is required to submit to USDA, one of the things that they have to track is out of state purchases. And they have to get like a baseline before this went into effect. And then they have to report out of state purchases made basically. And so we will see, I think the first quarterly report is due in mid-May. Obviously, we'll try to get our hands on those as soon as we can. That is something that the state is required to track. And so we will have that data eventually. I think right now it's too early to say anything definitively. I know Axios Des Moines did have an article out, I think the start of this week or last, just that there are some retailers bracing for that to happen. I think they're also required to report whether retailers start opting out of like being a SNAP retailer too. So we should have that data eventually. It's something the state is required to report. We don't have it right now.
Luke, do we have good data on what portion of SNAP sales are running through our, it's sort of like how important the farmers market nutrition checks are for, vendors at farmers markets. Do we have that kind of data for grocery stores in Iowa?
Like how much of SNAP is redeemed at grocery stores?
Yeah, and I guess we should talk about quick shop retail places as well. Because
Sorry, I'm
that just makes
searching
the
my memory
argument.
bank.
Yeah, it just makes the argument of the economic impact of this, which I think is important in talking to our local legislators.
Yeah, there's not a monthly report that exists for this. I think USDA has some of this data, but there was also a report done by Iowa HHS a few years back that looked at kind of where SNAP purchases were being made and types of retailers. I'll try to find that, and I can send it your way, Jan, because the state did look at that a few years back. And I know that there's other national data sources. The retailers probably have a lot of their own data that they don't necessarily share, but you know, we do know that about half of the SNAP retailers are convenience stores in the state. So we do have the number of SNAP, you know, retailers and kind of how those break down of farmers markets and grocery stores. We don't necessarily have what percentage of overall sales are going to, you know, those types of retailers.
Piggybacking on that, does the convenience include like Dollar General type stores?
I believe that's a different separate category. I think dollar stores have their own category, but I'll go back and look. Any other questions? All right, well, I will just end on Hunger Coalition is working on a blog post right now around the SNAP restrictions, some of the finer details, and also how you can take action. We're hoping to get some answers from HHS on how people can, you know, file a compliment or complaint, because that's a little unclear right now. And we want to make sure that that's going to the right inbox, so to speak. So we'll probably have early next week a post out with all of this information and more. Yeah.
Can we get Ron to unpack his comment there in the chat? I don't completely understand that. Seems important.
Yeah, go ahead, Ron, if you're willing.
Actually, for the dollar stores, as you were mentioning, I was trying to start one question when you gave me another, especially in regard to the dollar stores. You would think even if they were in a different category, they'd be included in the receipts for SNAP benefits received, wouldn't you?
Yeah, they would. I'm not sure. I forget if they have a separate category or if it's under the convenience store category.
Furthermore, I can confirm that Quick Trip and Spencer does label for SNAP benefits, and the other aid for dependent children are also labeled on a majority of their products. So I can confirm that for you.
Yeah, thank you, Ron. This is why we love these statewide monthly calls, because we've got folks from all over that can provide updates on every part of the state. And I think, Sierra, what you just shared, if I'm not mistaken, I'm going to pull it up, is a great resource. And I probably should have included a slide. So the link that Sierra Douglas just shared in the chat, this was a national report that came out not too long ago from the grocers and a few other trade groups that talks about the cost of implementing these SNAP restrictions nationwide. And what it found, oh, and you've got the kind of cost breakdown here. So they have cost breakdowns of what this implementation is likely to cost. And I think there's a piece in there that says they're kind of estimating that on average, convenience stores will lose $1,000 in revenue a week. You can find that in that report. It also talks about just the cost to implementing it. In the first year, they estimate nationwide, the cost is going to be $1.6 billion. And then going forward, it's going to be about 780 million every year just to keep this. And very explicitly at the end of the report, it says retailers are going to pass along these prices to consumers. So I just want to make it very clear. Implementing these SNAP restrictions are going to raise prices for everyone. And the number one reason that folks on SNAP can't eat healthier is the high cost of healthy food. And it's only going to make it more expensive. So again, this is why we oppose these restrictions. Well, we oppose them for a number of reasons. But this really doesn't get at the affordability issue. It's only going to make affordability worse. And we know that that's the big thing around healthy eating. We can't just ban items and expect people to be able to afford healthier items. It's not going to work. And so this is going to have an impact on all of us. We are all going to pay more at the grocery store because our government has decided we want to restrict certain items from people on SNAP. And I think that's a really important thing to bring up when you're having conversations around this.
Luke, adding on to that comment there that you just had, and then looking at a comment from Ron up above stating that people are possibly turning to restriction-free food pantries. I'm just curious if anybody else in this group has any other thoughts on that, if they've seen or if there's a correlation in the increase of usage of church pantries and other things like that, as opposed to using SNAP benefits.
Yeah, does anyone want to weigh in on that?
I've wondered the same thing. Yeah, it's a really good question.
I might pick on Blake or Kathy from DMARC, my colleagues there, if one of them wants to share, but we have really good data that very clearly shows when SNAP policy is impacted, we see the impact at food pantries. And some of this is hard too, because we also have these HR1 changes going into effect where refugees and asylees are losing benefits. These work requirements are going into effect. And so we may not be able to exactly pin down, you know, what is the source of why we're seeing more people.
Yeah, this is Kathy, and that's exactly what I was gonna say. There's like so many things happening that we really don't know at this point what's driving what.
So Luke, this is maybe a longer question, but since SNAP is being attacked, it feels like from so many angles, and your point is they are failing to really address the root cause of affordability. Is there another layer of all of this advocacy and argument that we should be thinking about that is sort of like SNAP point two or food affordability, food access point two, or you know what I'm trying to say? It's sort of like thinking ahead instead of continuing to try to defend something that is clearly under attack. Not that what futuristic step might not also be under attack, but it seems like the fundamentals are easy to chew at and because there's some vulnerabilities in them. So I just pose that for food for thought.
Yeah, thank you, Jan. I really, I appreciate that. And we always do try to have some positive things we're working toward because we don't just like playing defense. And so one of those is double up food bucks. I mean, we've been working on this for years. And part of the reason why is because it gets at maybe some of these same issues around healthy eating in a much more incentive-based approach that actually makes those expensive items more affordable for people, rather than restricting. So we try to have alternative visions for all of these, around SNAP. You can visit our policy priorities, but one of those is aligning SNAP income eligibility with other nutrition programs, which right now SNAP's income eligibility is lower than a lot of other nutrition programs. It's 160%. A lot of other nutrition programs are 185% of the federal poverty level. Aligning it would probably make things easier, on streamlining if HHS wants to get to a single, application and benefit portal. So there are things I think we're working on. I know a lot of you folks are also involved in the Iowa Food System Coalition, and I saw Mallory share their day on the Hill. I think there's groups that are trying to lay out an alternative vision, both as it relates to our food systems, but also economic justice. There's another kind of coalition forming around economic stability and strong families. And so I think we have folks who are working toward a future vision. just given the dynamics right now, a lot of that is education at this point, because we might not be able to see a healthy school meals for all bill advance this legislative session, just given the makeup, for instance. But we can be doing education and laying the groundwork for future policy change. And maybe that I missed your question and I apologize, but
No, that's fine. That lifts up some things that I haven't been studying the IHC website in great detail. But it makes me think about the importance of the core principles, right? That might be manifest in SNAP or anything else that you're saying. And I think that just reminds me to think about those consistent messages so that we don't get tripped up in the immediate debate, but hold legislators accountable to those core issues, regardless of kind of like, what happens and what package the advocacy is focused on at the moment. So I'm sort of talking out loud and evolving my thinking as you're going. So thank you.
yeah, no, thank you, Jan. I always appreciate your feedback and insight.
I have two things, food for thought, if I could.
Yeah.
Actually, and these borderline on the subliminal. The first one would be that I feel that people where I live are almost worried more about their information than they are sometimes even their desperation. Second thought, and to me, this is a subliminal move as I was looking at the bigger picture as I serve where I do. Uh, it seemed to me that Governor Kimmy, in her removal of some of the SNAP benefits and the work restrictions included, it was almost like she was attempting to force people to return to the church for their needs physically and their, for their food benefits. As I see it, the ones that are associated with government or other nonprofits have some form of paperwork to fill out, and the churches don't. Food for thought. Thank you.
Yeah, I think you're touching on something there, Ron. And one thing I think too of Senator Joni Ernst, when she first got elected, I remember wrote an op-ed that was kind of like, back in my day, the churches took care of people. It wasn't the government. Which I work at an interfaith organization. We've been doing food pantry work for 50 years and we're breaking records, so the churches are still doing this and a lot of them are breaking records. But I think you hit on kind of this idea that this isn't the government's role. This is charity's role. And I think we need to be really loud in countering that. Yes, charity has a role, but so does the government. And Feeding America has that stat that for every one meal provided by the charitable food system, SNAP provides 9. Feeding America is the largest nonprofit in America, and they do not have the resources to make up, even, smaller cuts to SNAP. So I think we're going to be seeing this. We're already seeing this. We've already been seeing this in Iowa. Again, food banks and pantries are breaking records. SNAP is at an 18-year low. That dynamic is only going to get more pronounced over this year. And I think, you really touched on it, Ron, and it's something that we need to be countering and talking with folks about. If you're talking with a candidate, ask them, what do you believe the government's role is in feeding its people? And might get an interesting answer, based on that. So, yeah.
But I think you can, for some of the story, you can point to what it was like last summer with the healthy kids rolling out, depending on our all volunteer food pantries, stressed them beyond capacity to put all of that burden on our local community volunteers. And they must be sighing a little bit of relief to see summer EBT supposedly coming online, but the capacity is not there in our local communities.
Yeah. Well, and Jan, I will say it's a big sigh of relief. I've spoken to, it is a big sigh of relief that we will have summer EBT this year. Well, I know we're at the hour. Thank you all for joining. Love the discussion. We'll be sending out the slides and the recording. If you ever have any questions, please don't hesitate to reach out to us, iowahungercoalition@gmail.com. Please register for the Day on the Hill on March 12th, and we will see you next month. Thank you all. Keep up the good work.